Welcome to the BC chapter of the Canadian Association of Critical Care Nurses Fall 2023 Innovation Roundtable held on October 19th.
We'll move on to the next presentation, which I'm super excited about because Saemy Cho and Carmen Najukat are going to tell us about their experience in the new grad transition to critical care at St. Paul's. So I'm super excited to hear what their experience has been like and see what kind of questions and stuff everybody has for them. Take it away, folks.
Hi, everyone. So thank you so much for joining us here today. My name is Saemy Cho, and I have Carmen here with me to present. And we're registered nurses working in CICU at St. Paul's Hospital in Vancouver. And we are here today to talk about our lived experience as a new grad nurses transitioning into critical care through the pilot program that has launched in 2022 by Connie Clark, Laura Parker, and Dion Norby.
All right, so just before we get started, we just wanted to do a quick land acknowledgement. So we acknowledge that our province of BC is located on the homelands of 203 distinct Indigenous nations and cultures with over 30 different languages and close to 60 unique dialects spoken in the province. And we ask that all of our participants here today reflect and acknowledge, honor in their own way the First Nation land in which they live, work, and play.
So our presentation today will cover the brief recap of what the pathway timeline looks like. Then we'll go through our experiences in each step of the pathway from ESN, preceptorship, transition RN, and to critical care nursing program, and the presentation with overall feedback, which we've received from all participants of this pathway. So let's start with what the pathway looked like for us. So this is a brief summary of the critical care pathway, which I borrowed from the presentation that Connie, Laura, and Dion did last year. The pathway starts in term 6 of the BSN program, which is the second year of the nursing school at BCIT. Term 6 students are introduced to the specialties of nursing, which they can take first 2 courses of chosen specialty program during their final year of BSN program. To apply, students submit the expression of interest along with the 3 choices of their specialties. So everyone in the pathway has chosen critical care as their first choice. In term 7, the students are selected into the specialty. They get to take the very first course of the specialty program. For us, it was critical care nursing theory number 1 course. This is when Carmen and I also started our ESN shifts as well. I started after finishing term 7, but for some cohorts, they had the entire summer to complete their ESN hours as well. In term 8, this is the last clinical in acute care of the BSN program before the preceptorship. So pathway students are placed in either cardiac unit or medicine unit at St. Paul's Hospital, where a lot of patients are transferred in and out of the CICU or ICU. Students will continue to work through their ESN shifts throughout term 8 here, right before preceptorship to achieve from 300 to 350 hours in total. I was placed in medicine unit and have worked through the term 8 through my ESN shift and even after the term finished in ICU to complete those hours. So term 9 is the final preceptorship of the BSN program. Students will have either 1 or 2 designated preceptor. For myself, I had 1 preceptor for the entire term and finished my preceptorship in ICU. And after the graduation, we were able to ask for a break before starting the transition RN. I had July and August off and started in September after graduating in June. During transition, most of students also write their NCLEX as well. So this is the brief overview of what the new grad nurse would look like in the pathway. So the new grad nurses start as a transition RN in CICU, where we work with the full scope of practice as an RN while having a buddy nurse supervising us 1-to-1. This transition is anywhere from 4 to 6 months. Students are also finishing the online portion of the critical care nursing program, the critical care nursing theory 2, while working their way into the transition period in CICU. So after the transition, the students then start full-time in-person critical care nursing program at BCIT and have their clinical placement in ICU at St. Paul's Hospital. After finishing the program, the students are then hired as a full-time critical care registered nurses in either CICU or ICU, depending on the student's preference and also availability of the lines in each unit. Now that we have some foundation into what the pathway looked like, I would like to introduce each cohort of the pathway we have up to date. So the cohort number 1 is myself, and I am working in CICU since April of this year. Cohort number 2 just finished their critical care nursing program in September. 2 of them are start to work in CICU, and then 1 has started working in ICU. Cohort number 3 will be Carmen's cohort. They're currently in transition RN phase in CICU and will start their online portion of the critical care nursing program soon. And cohort number 4 is a preceptor student in ICU, and she will be finishing her BSN program this December. And lastly, the cohort number 5 is our ESN students in CICU who are in term 8 of their program, the BSN program, and they are completing their second course of the critical care nursing program at the moment.
So just before we go over each role, we just kind of wanted to touch on how we collected our data about our feedback. So we launched a survey to all of our pathway students to gather some more information about the experience they had at each step, and then just about the overall feedback in general. So now we'll just get into it, starting with our employed student nurses. Our ESNs worked in either ICU or CICU. So during this time, there was quite a bit of variation amongst our experiences. So we did have what we did have in common was that overall our confidence increased at school, especially within our clinical placements. Students felt that our scope of practice during this phase of the pathway was very sufficient. So in this role, it's more about getting exposure to the critical care environment and more so about assessment skills, critical thinking, and we felt that our scope really supported this. Our ESN experience also really supplemented our learning in nursing school and gave us a lot more learning opportunities than normal. So we were consolidating our head-to-toe assessments on critically ill patients, giving handover, beginning to participate in rounds, and then observing so many different procedures that we wouldn't have normally been exposed to. Some of the challenges that we did note were there was just kind of a bit of a need for more guidance through critical thinking and decision-making through these shifts, just in preparation for preceptorship. And ESNs, they don't necessarily have one specific person they work with. It's always working with different nurses every shift. So it can be a bit confusing with the different levels of understanding of what your role is and what the expectations are. And then we just felt that there was a bit for more of a need for constructive orientation, especially with your first time going into critical care. So that brings us into our feedback from our next phase, which was preceptorship. Again, our students were either in ICU or CICU. So overall, during this step, the students had very, very positive experiences with their preceptors. Students found them to be very dedicated, supportive, pushed independence, and had very realistic expectations of us in this setting. Students also felt they learned how to think critically, how to prioritize, how to multitask, and especially had good opportunities to learn how to care for 2 patients, which happens a lot in our ICU and CICU. We did notice, however, from our feedback that towards the end of preceptorship, the confidence levels varied a bit. Some of our students thought that they were super ready to take on the next steps, very confident, whereas others felt like their confidence wasn't really where it should be. Also, the transition between ESN and preceptorship with regards to expectation, knowledge, and critical thinking was a bit overwhelming, I think, with the lack of guidance in the ESN phase. So this was also definitely an adjustment. And then sometimes the patient assignments were a bit, I think, just not super appropriate. The level of acuity was maybe a bit too high and beyond the knowledge base of the students just at that time. And our ICU and sometimes CICU is a regular placement for critical care students in the BCIT program. So there was a lot of confusion sometimes and issues with patient assignments between preceptor students and critical care students.
So the students are now graduated from the BSN program and working as a full-time transition RN in CICU. So at this stage, all students have written and passed NCLEX on their first try or working full-time. Personally, the 2-month break after graduation helped tremendously to give my 100% to get back to studying and working. Also, working in CICU helped a lot with studying for NCLEX, as it helped me to keep the material fresh and familiar while building up that muscle memories as well. Right after the graduation, we felt the level of confidence as a new grad nurse was high, 8 out of 10 on average. I felt pretty confident starting in CICU as a transition RN as well, since I already had spent more than 800 hours in ICU as an ESN and preceptorship student, and was excited to just start working and with the expanded scope of practice, not being a student anymore. Working within the full RN nurse scope of practice allowed us to consolidate some of the basic but also critical nursing skills that we were not able to do as a student, as little as flushing those central lines. Moreover, we found the staff nurses were more receptive and had more positive demeanor working with us as well, as we could be more independent, and there were more things that they could teach us and guide us versus when we were a student. The 4 to 6 month length spent in the transition RN was also adequate to slowly build our confidence, independence, and while consolidating our critical thinking and skills as well, and to familiarize ourselves with the new staff, new unit, and some protocols that are specific to cardiac ICU. Those time frame was very sufficient. While it felt it was enough time to familiar with the unit, the initial transition going from ICU to CICU was a bit challenging. Although the CICU is still a critical care unit, we needed time to adjust to the new protocols, new unit culture, new staff, and also different workflow as a new grad in the new environment. This brought out the need for a more constructive orientation that is specific to CICU. So, for example, orientation on pacemakers, management of PA lines, patient care, post-cath lab, to name a few that were not really done in ICU, were very new to me, and I needed time to read the protocol and standard the practice, learn the rationales before actually start to provide care. Another challenge that we have noticed was the patient assignment for transition RNs, because the nature of the cardiac patients and also a lot of ward-ready patients on the unit, sometimes there are many doubles that we get assigned to, and from the surface level, it does make sense to assign heavier patient load to a nurse who will be working with the transition RN. But however, we thought that to maximize our learning and to promote our independence, it will be important to assign patients with increasing acuity towards the end of the transition RN so that we will be more prepared to start the critical care nursing program. So after being in transition for 4 to 6 months, the students are now away from the hospital and becomes a full-time student again in BCIT. So prior to starting the program, most of us felt very confident to enter the critical care program. Personally, I was very excited to go back to school and learn. Even after finishing the program, many of us felt confident to start working independently with the average confidence level of 7 out of 10. We were all just very excited and eager to learn the material that we have seen and heard while doing ESN preceptorship and transition RN. The topics discussed in the program, such as the shock, ACS, and ARDS, were really familiar to the students and was easy to link back to the cases that we've seen in practice, and which also then helped with the studying and applying the knowledge into practice. As a critical care nursing students, we found the staff were very and more receptive to us and start to accept us as their new future colleagues. Lastly, but most importantly, we were also able to receive constructive feedback from the instructors in critical care nursing program. This is very important to us as we thrive on the feedback and have lacked such opportunities throughout the pathway. The feedback I received from the critical care instructors was far more in-depth, as some of the buddy nurses that I work with are usually short with times to provide more in-depth feedback, and they're taking patients while teaching us. And all the other support that we had in place did not have the opportunity to see us working to provide with the proper feedback. Most of us really believed that the program was fantastic. We were able to really dive deep into the topics that we were eager to learn about and finally had the chance to do so in that program. The only downside was that some assignments from the program did not really seem to be applicable to Pathway students. Some of them voiced that we could be treated like a bridge-in students who are exempt from such an assignment while taking all the other courses of the program as well.
All right, so for the last section, we'll just go over the overall feedback we received from our survey, and we'll just start off with the experiences that we had with our support system. So overall, 80% of us felt supported throughout the pathway, while 20% felt somewhat supported. We had regular check-ins with faculty members, program heads, mentors, instructors, and educators at different points of the pathway. And some of the clinical nurse leaders that worked on both units checked in with us regularly during our shifts to see how we were doing, which we really appreciated. But overall, we did feel most supported by our fellow pathway students. We did notice, however, that there needs to be stronger support for ESNs, especially in the beginning and establishing themselves in this pathway, because they do mostly work on the weekends around their school schedules, which is not really when faculty, program heads, educators are usually working, which kind of leaves them without someone to ask questions and without someone there, or they just have to kind of wait until they're able to.
And the next question we have asked the pathway students were how welcome they felt from the staff of the units when they were undergrad students versus when they were transition RN. As you can see from the pie chart, the students rated the this welcomeness from anywhere from 3 out of 10 to 10 out of 10. We do notice that the experience varies really heavily on their personal experience, and 1 or 2 bad experience can really ruin the many of the positive experiences. But I do want to make note that the majority of the students felt welcome from the staff rating 8 and above here. And this one is the pie chart where the students rated the welcomeness into the unit as a transition RN. Well, as students, we rated the welcomeness anywhere from 3 to 10. As a transition RN, the range kind of like goes up from 7 out of 10 to 10 out of 10, with 9 out of 10 being the majority. We have included these 2 slides as they bring up another important factor to the success of this pathway and the students, the staff nurses who are directly supervising and working with these students here. So as you have seen in the slides, the students felt less welcomed in general as a student in comparison to when they were transition RN with the full scope of RN. This could be due to the workload put on to the body nurses as heavier when they are supervising the student nurses versus a transition RN. So therefore, a support system and a proper compensation is critical and required for the staff nurses who are working with the students to create an overall learning environment for everyone here.
So we also just wanted to ask our pathway students a few questions about recommending this program to other students and also about retention upon completion of the program. But just to keep in mind, our first cohort, which is Saemy, has just passed 6 months of independent practice. So it's not like a ton of data that we have yet. So in recommending this program to other students, a large majority, 85.7% said they would. I think 1 person said they would not. So next, we asked our students if they would most likely stay in a critical care environment in the same hospital after the contract on a scale of 1 to 10. So after we finish our critical care program, we are put in an 18-month contract. So 1 being no, I'm not going to stay, and 10 being would definitely stay. So we have a lot of variation here. We have some 5s, some 6s, and then we also have some 9s and 10s. But at this point right now, everyone's in very different stages of the pathway. So this may change, may not, once everyone is developed into their independent practice.
So, we came up with some of the suggestions for improvement as well. So as we have seen in the survey results, students felt most supported by the peers in the pathway, whether it be from the same cohort or the different cohorts. Connecting the students with the peers earlier on in the pathway would really help the students to prepare for what comes next and also get advices and vents. The second point that we want to mention is the need for more structured support system and orientation in the beginning, especially when students are starting their ESN, also when they're transitioning from ICU to CCU. These students have learned the head-to-toe assessments, but not specific to critically ill patients or the cardiac patients. The orientation could include what the assessment and the workflow would look like in the new environment so that the transition can be more smoother. Moreover, just a review of the common illnesses and syndromes and the drugs that will be seen in the unit could be included in the orientation as well. The structure, the support system for ESN could provide more support on site in terms of scope of practice questions and ambiguity here, guide students with a variety of the experiences that is available in the unit that students might not know, and also to just answer general questions that buddy nurses might not have the answers to. And the next suggestion is to receive some form of feedback and regular checkpoints, not just to gather information about the student's experience, but also to track their performance as well. These checkpoints could be very helpful to pinpoint the areas the student need to work on and then how to navigate their workload better and prepare for the next step as well.
So one thing we wanted to offer our suggestions for improvement on was that we feel that there needs to be maybe more support for staff in supporting the students. So right now the preceptorship premium pay, I think, is only offered for final placement in preceptorship and for critical care students, not necessarily for ESN or transition RNs. And then additionally, if someone is really opposed to having a student for whatever reason, this doesn't necessarily create the best learning or working environment for the nurse or the student. There may be benefit from having dedicated nurses on the unit for taking on these particular students. And then additionally, we are on our 5th cohort entering this pathway, and the onus still remains largely on students to explain our role, scope, purpose. And we do understand the different phases of this pathway, and changing scopes can be confusing not only for us, but also for the nurses to keep up with and the unit as a whole. But this does show us that there needs to be a bit more education for staff regarding what this pathway is. And they should be provided written documentation if they haven't already about what it is and each step and scope and changes. And there may be a need for a person who is a point of contact, like maybe a mentor or someone familiar with this process who's available for staff to ask questions or for guidance, especially around scope.
So we would like to finish our presentation with 2 quotes that the students have shared in the survey. My preceptorship experience overall was extremely positive. It helped me to grow tremendously in my critical thinking and practice as a nurse. My preceptor really pushed me in a realistic way to be as independent as I could within my scope. The unit also treated me with a lot of respect, and I felt like I was more part of the team than just a student. And one more. I liked the structure of the pathway. It allowed me to slowly build my independence while working on my confidence level. ESN was a perfect opportunity for me to find out whether I would like to stay in critical care. Preceptorship allowed consolidation of basic nursing skills and use of critical thinking while caring for critically ill patients. Transition RN expanded the scope of practice and was enough time to be familiar with those skills while building on the independence and getting ready to start the critical care nursing program. And
so we just yeah, we just want to thank you so much for listening to us or in our experiences. We'll now take questions, but we just wanted to give you a little disclaimer. We don't have a lot of answers regarding like logistics, how we're selected, health authority type questions, or how it'll expand to other hospitals. Like we can specifically answer questions about our own experiences. Thank you.
Great. Thank you both so much. I just want to say you both did a fantastic job with your presentation. It was very well organized and very nicely delivered. So good job to both of you. I see Lindsay Dion has got her hand up.
Hi, I have a couple of questions for you, and thank you again for the presentation. That's amazing, and what an amazing program. My first question is just around your return of service. Are you able? I know it's 18 months after you're all done. Are you able to move around within your health authority? So you're at St. Paul's. Do you have to stay at St. Paul's to complete your whole return of service, or could you go elsewhere in Providence to do that?
I believe the contract states that we have to stay within that one health authority to finish that 18-month contract.
Okay, thank you. And then my other question, you alluded a couple times to the fact about patient assignment for your practicums and preceptorships, and then when you're in independent practice. Is there any structure around the kinds of patients that you can take? Does that exist for you guys as far as what is suitable for a patient assignment?
It is, I believe it is still a developing process to figure out what's going on, because there are just so many orientee students in different levels that are existing in ICU right now. So mostly the ESN students and the preceptorship students are assigning to ward-ready patients or stably vented patients, just so that they can work more within their scope of practice. And then, well, as they progress in the pathway, the acuity increases. That's how I believe it's happening right now.
That's great. That's great. Thank you so much. That's great. Thank you.
Vinny, I think you're up next.
Yes. So thank you, Saemy, Carmen. I'm just blown away. You guys are so awesome, and we're so lucky to have you as part of our team. So this is going to be a really silly question. So you said with an ESN, because the nature of the schedule, you tend to work on the weekends when there isn't as much leadership support. As the transition RN, did you still work primarily weekends, or did you have a more natural nursing schedule in that role?
Currently, my schedule is, because I'm in the transition schedule right now, it's both. It's on the weekends. It's all over the place, but I do still feel like I have the support that I need, even if it's on the weekends or weekdays. Like there's always someone available, like coworkers, educators, like anyone that I need. Like I'm never not feeling like I have support, basically.
Yeah. I think I can speak from our team. I think we've talked long and hard about how do we support our staff on off hours, and I know our educators have had our leadership team have had conversations about covering the later shifts and covering the weekends, and how do we navigate that too. So I think it's front of mind, not just for the ESN, but just for everybody, because that support is so useful.
And I see hands up from MSJ HAU.
Yeah, hi, thank you, Sibyl. Yeah, thank you for the great presentation, and thanks for taking on critical care. So we are trialing some ESN students as well through the high acuity specialty pathway. I was just wondering what drew you to the critical care? Like, there's different types of nursing. What made you decide critical care?
For me, it was very personal reason. I actually applied to nursing school wanting to work in a critical care. If you want to hear more about it, I won't take too much time here, but you can send me an email. But I had explained to that in the expression of interest when I applied, and then probably the admission committee really took it well, and then I got selected into critical care.
Okay, that's awesome. No, I'm just thinking for recruiting purposes. How can we make us look more attractive?
Yeah, thank you so much for sharing your experiences. This is really exciting, and I hope honestly that this is kind of where nursing education goes in the future, just because I think there are so many different areas of nursing that are so specialized that that you had the ability to start specializing earlier, so that you were able to graduate and kind of almost hit the floor running is super exciting. I was just curious though, because you talked about terms in I don't know if you can go back to your slide that was talking about like the different terms you were in with school. My understanding is that before you started, it was around year 2 or 2.5 when you decided that you were going to do the critical care route. So prior to then, is that when you had like all of your practicums like on med surge, like maternity? Like, had you been like exposed to many different areas of nursing before having to make this decision? And then afterwards, was it only critical care placements? Does that make sense, my question?
Yeah, so it's been a while since I graduated, but as far as how I did my school, I did the regular BSM program. So we did several acute care and community, public health, maternity, pediatrics rotation up until term 5. And then term 6 will be our second acute care. And then term 7, I believe, was the community. So we had some exposure to some of these specialties to make that decision in term 6 and then apply to whichever that we were interested in.
And term 7, that's a third year?
That is the application we submitted in term 6. So that will be towards the end of this term, year 2 of BCIT program.
Oh, okay, great. Yeah, this is it'll be interesting for future data collection on just the retention of students that are going through this pilot program in critical care. So that's great that Lindsay and Tracy are on, because I think this would be really exciting if it would be something that we could have in our health authority as well. So thank you so much for sharing.
Yes, I mean, it's great to see how much evaluation your team has already done on this program and your experiences. So the qualitative and quantitative evaluation that have gone into assessing this program so far, it's great. I see Jasmine, have you got your hand up in the chat?
Hello, thank you guys for an amazing presentation. My name is Jel. I'm a current BCIT student for the critical care program. I'm just wondering, as new graduate RNs during the transition line, did you think it would be beneficial for you guys to kind of extend the term just to consolidate more of your nursing skills, as you, I guess, technically you don't have any previous nursing experience? Do you think it would be beneficial to prepare you for the critical care pathway for BCIT?
I personally thought that 4 to 6 months was enough for me, because we were also continuing our clinical in ICU as soon as we get into the critical care program. I don't know how Carmen feels. She's doing the transition right now.
So I started transition in August. So I'm almost hitting 3 months now. And I'm starting to feel like fairly good about myself at this point. Obviously still so much to learn, but I feel like in the next few months, like I feel like it will be pretty sufficient. Like I'm starting to be very much independent from my buddy nurse, and like just kind of talking through new situations and patients that I like, patient diagnosis and procedures that if I haven't had it before, like obviously being more collaborative with my buddy nurse, but I'm starting to feel a lot more independent and confident, because at this point I've been working in a critical care setting for almost coming up on a year now. And I feel like that basis from this pathway has really helped with preparing me, if that makes sense.
Yep. Thank you so much.
You talked, I wonder if you can expand on, you talked about some of the assignments in the critical care program not being suited for a pathway approach to the thing. Can you maybe expand on what those assignments were and why? Because it's been like 25 years since I did my critical care, so I don't quite remember. I remember a big essay, but I don't quite remember all the assignments anymore.
So it's towards the end of the second theory course, where we get to write about our experience going into critical care environment for the first time. And the Bridgen students who were previously either in HAU or Emerge are exempted from that specific assignment, because they were kind of like exposed to the critical care. And we thought that that was not really applicable to us as well, because like Carmen mentioned, we are coming to nearly or over a year into critical care environment at that point. And just having that new perspective about the critical care environment is just not really applicable to us.
Hmm.
I heard you both mention that some of the things that you wish were different were that the staff nurses were prepared a little bit more for where you were in the placement. I can totally appreciate that. If you had to think of any other things that would have made this experience better for you, what would they be, do you think?
I think one of the biggest motivation that I had just going through this pathway was just focusing on my intention coming into critical care. And so just going back to someone who asked me about the recruitment of the students, I think if someone has very strong intention about working in the critical care, whether they're new grads or experienced nurses, I think it's important to figure out what their intention are and also like how motivated they are, because this program, it is challenging. It is very mentally and physically challenging pathway, I'm not gonna lie, but that is something that would keep you going, and I believe it's the same case for everybody else in the pathway as well.
That's a really good point. And you also mentioned how the pre-work, like before you got into the BCIT program, really helped you prepare for that transition into the BCIT program. I know for me, going into that, it was like learning a whole new language. And so I can see how the initial exposure to the critical care environment would have been helpful to make some of those concepts that were learned during the BCIT program sit with you, so you didn't have to process that at the same time as learning all of those specific critical care skills. So that's really interesting that the whole program here kind of spreads out the learning to help you consolidate more fulsomely, it sounds like. That's great.
It's almost like putting the pieces back together.
Yeah.
So you were collecting the pieces along the way, and then in the critical care program, you're like putting them all together. Yeah.
And you would have been exposed to more experiences working in that critical care environment than some of the students going into the BCIT program without this kind of bridge area. Like they might have been exposed to some of those concepts on mid-surg, but not nearly to the degree and exposure that you would have been doing your ESN period within in St. Paul's. That's awesome. What a really nice way to bring people into the critical care community, help them feel supported. That's excellent. So so thank you both very much for your presentation. You did just a fantastic job, and just blown away at how well you guys did here. We'll close off the roundtable today.
Thanks for watching, everyone, and thank you for joining us on the BC chapter of the CACCN YouTube channel. We have a lot of great content from previous events we've had over the past 12 months. I would suggest subscribe and hit the notification button so you can know when the next thing is out. And if you ever want to come to our next event, we're on Facebook and on Instagram. Our links are listed below. And while I'm on the topic, if you're a critical care nurse anywhere in Canada, why don't you join CACCN? We have a ton of resources to help you be the best critical care nurse you can be. Go to caccn.ca and join us.